Father Ari D, Principal Jane Cacacho, beloved teachers, honored parents, and of course, our grade 6 graduates. Good day. I am JP Leung, Xavier Batch 86, and I'd like to thank you all for the opportunity to speak to you today. I was in Xavier for 13 years of my life, from 1974 to 1986. I don't remember much about preschool, except a whole lot of playing with classmates and friends. In grade school, my favorite subject was research and lunch, not because of the food, but because we would run to the gym or quadrangle to play patintero, football with bottle caps, or football. I was a so-so student and received my share of green slips for a variety of reasons. You could tell I was naughty because our class advisor, Mr. Maramag, would keep the magulo students near him during the picture-taking session so he could keep us in place. Graduation from grade school to high school meant many things, moving on from khaki shorts to blue or black long pants, from playing marbles to ping pong, and from patintero to basketball. It also meant learning a whole lot more: new subjects in class, new extracurricular activities, new friends to hang out with, and perhaps most important, developing a new level of spirituality. When you graduate from Xavier, you learn these by heart. Initially, they might just sound like mottos or taglines, but through the years, the spirit of service is ingrained into us. Luciat lux, let your light shine. I was accepted into and eventually graduated from the UP College of Medicine in 1993. After I graduated, I spent a year working with the Mangyans of Mindoro as a community physician before eventually returning to do my orthopedic residency at the Philippine General Hospital. An orthopedic surgeon is a specialist in the management of musculoskeletal conditions. I have been working in Baguio and Benguet for the past 20 years, taking care of the musculoskeletal problems of young and old patients alike. In the year 2020, COVID happened. What started out as news reports of a virus in China, in the span of a few weeks, became a frightening reality for us in the Philippines. Here was a new virus, which seemed to be affecting people from all walks of life and all ages. Hospitals were deluged with patients who needed intensive care. The medical community was at a loss because no one knew how to treat this new virus. How do we treat it? How do we prevent its spread? So much we didn't and still don't know. And this caused fear. What we did know was that in some vulnerable populations like the elderly or those with underlying diseases, COVID hit hard. Medical frontliners who attended to COVID patients fell ill in alarming numbers. And it also hit uncomfortably close to home, as San Juan, and Green Hills in particular, was one of the epicenters of the early outbreaks of the disease. I remember the fear I felt during this time, the fear of being helpless against an oncoming scourge. And out of instinct, as a response when I faced difficult times or situations, I prayed. I prayed for the safety of my family, of healthcare workers, and for guidance. Fear can lead to one of two responses. In the animal kingdom, it can lead to paralysis and inaction, like a tortoise retracting into its shell, an armadillo curling up into a ball, or an ostrich burying its head in the sand. In humans, however, fear and threat can lead to the opposite course, that of taking action in the face of danger, to protect oneself, one's family, and one's community. The Savior community did exactly this, establishing the Kalinga Contra Corona response to the COVID-19 pandemic. Initially spurred on by one of our ahias, the brother of a batchmate and co-orthopedic surgeon, Dr. Gar Eufemio, who was my chief resident at the PGH. Eventually, the entire Savior community, students, alumni, parents, responded with a Herculean effort, converting the grade school sports center into a bodega of relief goods and supplies, starting, furnishing, and manning the much needed San Juan City Quarantine Center, and volunteering long days of manning the centers and coordinating the donations and the recipients. Many of my batchmates, I am proud to say, including some of your parents, were tirelessly involved in this effort. The KKK also reached out to alumni from all over the Philippines. We in Baguio were some of the early partners and beneficiaries. Although COVID 19 is primarily a respiratory disease and not in my specialty as an orthopedic surgeon, it was painfully clear that our hospitals, and more importantly, our frontline health workers, were unprepared and unprotected for this pandemic, and that if I could not help treat patients in the ICUs, I could try to do something for the frontliners. With the help of the KKK, we were able to distribute PPE supplies, bottled water, and even test kits to the different hospital and quarantine centers in Baguio and Benguet. Our hospitals began to fill with COVID patients. Our regular wards were converted into COVID wards, which means less room and staff and resources to take care of the non COVID cases. We could only attend to emergencies. One of the services to suffer was our weekly clubfoot clinic, which has been providing free treatment to patients born with a clubfoot deformity. When COVID happened, the parents of our patients were unable to bring their children to clinic because of travel restrictions, lack of public transport, and the fear of bringing them to a COVID hospital. We tried our best to do follow ups through the internet and Facebook, asking parents to send regular pictures of the feet of their kids. But as the pandemic dragged on, kids outgrew their braces and stopped wearing them, and we were worried that some of their corrected deformities would recur. For our patients who couldn't come to the hospital, we tried to arrange meetups outside the hospital. But to reach the parents who couldn't come because they had no means of transport, we arranged a bicycle brace delivery service. Parang Grab Cargo, except we were the ones who biked from Baguio to anywhere between 25 to 50 kilometers to visit our patients, check their feet, and provide new braces for them. So you might ask, why do we go the extra mile? Why did the Savior community give so much of their resources, skills, and time to react to the COVID crisis? Why did we spend hours trying to secure PPEs for our frontliners? Why do we bike 25 to 50 kilometers to visit our clubfoot babies? Not for money, not for fame, not for glory. I believe that Saverians do this because they have been trained to be men for others, to let their light shine for others. After a year in the pandemic, where are we? It's now March of 2021. There is a new spike in cases, new variants of the virus, and new lockdown restrictions. However, there is also a glimmer of hope. We do know that preventive measures are effective in preventing spread of this virus. Vaccines are on the horizon for most of us, and there have been improvements in treating of patients with the disease. So what can you, a grade 6 Xavier graduate, do? St. Francis Xavier said that the path to doing the impossible begins with small steps. Be great in little things. So to you, I say, stay safe. Remember to wash your hands, wear a mask, social distance. Trust in the science. Don't spread fear and disinformation on social media. Encourage your families to get vaccinated. And try to look beyond the numbers. Each one tells a story of a death, an illness, and the person in need. Ask yourselves, how can I help? During this pandemic, people are hungry and may need to be fed. People are depressed and may need to be cheered up. Reach out to them. If there's a lesson to be learned in this pandemic, it is that we are only as strong as our weakest link. This applies to communities, hospitals, schools, and families. You can help make sure that we protect our families and our communities. Only by doing this together can we succeed. As I was looking through your classes, I was pleasantly reminded of an old friend, Brother Richie Fernando, who was actually a batchmate from way back in high school, a classmate during the Ateneo Junior Summer Seminar. He was kind, good natured, and not surprisingly, one of the crushes of our female classmates then. He joined the Jesuits and was assigned to teach in a year for a school for disabled children in Cambodia. In 1996, as I was in residency, We heard that he had been martyred, trying to pacify a mentally disturbed student who had brought a live grenade into his classroom. He shielded his students from the blast, but ended up having to sacrifice his own life. Not all of us can be martyrs like Brother Richie, but all of us can choose to live a life following Christ. This is what Brother Richie himself said. In the end, God, through your parents and teachers, have given you the talent that makes you a shining star. No matter how small your light, remember that together with others, it can be used to brighten the darkest night and light the way. Congratulations and Luciat Lux. Thank you very much.